Nutritional psychiatry, or sometimes called nutritional psychology, is all about how food affects your mood. And it's more than just mood, but that's an easy way to think of it. There's a really strong gut-brain connection, and primarily that connection is the vagus nerve. And it's not just from your brain to your gut, but it's a two-way street also from your gut to your brain. Did you know that 90% of the serotonin in your body is actually in your gut, not your brain? What is in your gut affects your brain, and therefore it affects your mood. Things like important neurotransmitters like serotonin, dopamine, glutamate, GABA, they're all affected by gut bacteria, your microbiome. Gut bacteria of a person with schizophrenia in one study was actually transferred into mice, and the mice actually showed signs of schizophrenia. So you can see that it really matters what's going on in your gut. Food can affect things like depression and anxiety, but also things you might not think about like ADHD, OCD, even brain fog. Depression is one of the main mental health issues that is affected by your gut, specifically your gut microbiome. And so there's foods that can help with that and foods that hurt it. What I'm going to say is general information. It's not meant to be medical or even nutritional advice for you specifically. It's just general information. So in terms of foods that actually make depressive symptoms worse, they would include sugar, high glycemic load carbohydrates like white bread, things like that, pasta, artificial sweeteners, aspartame especially, fried foods, bad fats like your trans fats, and then things like added nitrates or preservatives. So there's a very strong correlation between what's in your gut and depression, almost a direct correlation. As sugar consumption goes up, that affects your gut, and then that can make depression worse. When we talk about bad fats, we're talking about things like margarine, trans fats, hydrogenated oils. When I say nitrates, I mean things that are used as preservatives or color enhancers, things used in like bacon, deli meat, sausage. They're not really good for you, you know that, but they're also not good for your mental health, specifically depression. Foods that improve mood and depressive symptoms include things like omega-3 fatty acids. We get way too many omega-6s compared to omega-3s. Low GI carbohydrates, the healthy fats, spices like turmeric, and then prebiotics and probiotics. Probiotics being things like fermented foods. There's a lot of things to keep in mind, but if you kind of get a handle on what's actually good for you in terms of depression, it's very doable, and it tends to just be things that are healthy in general. So some vitamins to think about would be B9 and B12. When these things are deficient, there's typically depression symptoms that are there, and vice versa. So getting the proper B vitamins, B1, which is thiamine, and B6 are also helpful. They help the brain produce and synthesize neurotransmitters involved in mood regulation. Vitamin A is important because it encourages the growth of neurons and proper brain function. Vitamin C regulates neurotransmitter synthesis, so all of these things are very important. Magnesium shows that when magnesium is strong, depression is less, and vice versa. When magnesium is deficient, depression is more likely. Food sources for things like this would be avocados, nuts and seeds, legumes, whole grains, and those omega-3 rich foods like fatty fish, and then nuts and avocados. Monounsaturated fatty acids should make up the majority of the fats in your diet for helping with depression. So things like olive oil, nuts and nut butters, and again, avocados. You're seeing a pattern here, right? Spices with noteworthy antidepressant properties would be things like turmeric, oregano, saffron, and turmeric with black pepper. That helps activate the ingredients in the turmeric. Prebiotics are things that have fiber that you can't actually digest, but the good bacteria can eat it. So it's like feeding the good bacteria. So that's why it's important. probiotics actually give you the good bacteria. So it's foods that are fermented and actually have good bacteria already. Things like kimchi, kombucha, kefir, sauerkraut, yogurt that has the live cultures in it. Those things are really helpful for depression. Anxiety is the most common psychiatric disorder in the United States. And sadly, only 50 or 60% of patients respond to the combination of medication and psychotherapy. So anything else that we can do to improve that is really potentially a game changer. And food is one of those things. There's been studies that have shown that there is a significant connection between the gut microbiome and changes in anxiety symptoms. People with generalized anxiety disorder actually had very different bacteria in their gut in certain studies of this, and sparser and less diverse gut microbiome than in healthy participants. Believe it or not, it only takes about 2 hours of stress to totally change your gut bacteria. And so there's, again, a really strong connection there between how you're feeling and what's going on in your gut. Things like tryptophan are really important for improving anxiety, and they're hard to get from food, so most people take that in a supplement form. Vitamin D is also super important for your gut microbiome and specifically for anxiety. Vitamin D actually crosses the blood-brain barrier, and so it has a strong impact on your mental health. 80% of vitamin D comes from sunlight, not really from food, so it's important to get enough vitamin D from the sun. Little adjustments that can be made in your diet can make a significant impact on anxiety. When someone comes in and they want to integrate nutrition into their mental health treatment plan, what we'll do is we'll pretty much start by saying, what is it that you're eating now? What does your typical diet consist of? And we'll say, well, what would be some things that might be helpful for you to add, some things that might be helpful for you to take away or to limit. And of course, I'll encourage them to talk to a doctor first. I'm not a physician, and so they need to check on those things to make sure it's safe. But once they have that, we can really say, what are some things that might help you in your mental health? And that can be very impactful in improving things like anxiety and depression and a lot of different other mental health conditions. My name is Dr. Jason Beaupied, and I'm a therapist here at Spanish River Counseling Center. So if any of this sounds interesting to you, you can go to our website, SpanishRiverCounseling.com, or you can come in person, and I look forward to meeting you.